All right, welcome back. With cold and flu season starting, doctors are also seeing a virus that is less well known. Now, that can cause some of the same respiratory symptoms. Joining us this morning is Dr. Uditverma to talk with us here from OSF. Thanks for joining us today.
My pleasure. Thank you for having me.
Yeah, so a lot of people have known of, RSV, COVID, and the flu, but not many people know about HMPV. What exactly is it and how is it transmitted?
So HMPV refers to human metapneumovirus. This virus was isolated around 2001 and interestingly belongs to the same family as the RSV. And it usually causes peak infections around winter all the way through the spring. Mode of transmission, respiratory droplets during cough, sneezing, speaking with someone who's infected, touching your face, eyes, nose with unclean hands, or maybe close contact like shaking hands. So that's the mode of transmission.
Yeah. Is this rare or is this pretty common?
It is a very common virus. So usually the infections from HMPV can sometimes even surpass those from COVID-19 or flu, especially around winter to spring time.
Gotcha. Which age range or demographic is most impacted?
So this virus can infect anybody, like other common cold viruses. Most of the time, fortunately, it does cause mild respiratory symptoms like cough, sinus congestion, fever. Having said that, this virus has the full potential to invade the lower respiratory tract in some vulnerable population like the very young, elderly, someone with weak immunity. And in those cases, it can cause consequences like pneumonia, bronchiolitis. It can flare up asthma or pre-existing COPD. And the hospitalizations from these infections, as I said, can even surpass those from COVID-19 or flu.
Are there any vaccines for this? I know there's the vaccines for COVID and such, but is there a specific one for this?
At this time, there is no vaccine. So prevention is your best bet. Just make sure if you are not feeling well, try to maintain a physical barrier between yourself and your unaffected family members, co-workers. Hand washing is very important, 20 seconds, hand wash with soap and water. And again, if someone's not feeling well, see if you can try to maintain that physical barrier with that person.
And if someone is not feeling well, now how do you recommend they should go about being seen?
So if you are having symptoms of cough, fever, and you would like to get evaluated, of course, you can always call your primary provider office. Here I would like to reinforce that you can take advantage of virtual care. OSF On Call Virtual Urgent Care provides you the same quality level of service as your primary provider office in the comfort of your home, 24/7, especially for minor illnesses.
Yeah.
And so I would, stress that, you should think about that.
Rather than using the gas money to go to the nearest clinic.
Or as I said, this also helps cut down on the transmission.
Yeah, absolutely. All right, Dr. Verma, thanks so much for joining us today.
Thank you for having me.
All right, we'll have this interview on our website. We'll share those details there, and we will be right back after the break.